Dr. Morris, you're a member of Ontario's Scientific Advisory Table, and you've acted as a consultant to the Toronto Raptors in the early days of the pandemic. If an NBA team like the Raptors or the Toronto Maple Leafs reached out to you right now, what advice would you give them if they said, "What do we do?"
Yeah. So I think the first thing I would say to them is they have to acknowledge the situation that we're in. And I think that's difficult for most people. This has occurred really quickly, and they may not even grasp the situation that we're in right now. So I would have to explain to them the situation, which is we're seeing really aggressive growth. We're seeing a double of case numbers every 2 days or less right now in Ontario. And those numbers are going to grow massively. And it will mean that most players on the team are likely to be infected over the next while, to some degree, despite whatever efforts we make. So we're going to be able to put it off for a little bit, but almost everyone is likely going to be infected. And so I'd say that the prudent thing to do would be to take a pause, at least for 2 to 3 weeks, to just see what is happening and what the landscape is going to look like. We will know much more information 2 to 3 weeks from now. We'll certainly know much more information 2 to 3 months from now. But I don't think most people in society want to wait 2 to 3 months, and governments probably don't want that either. But I do think that with the uncertainty that we have right now, it's really important that we try and minimize the number of people that get infected in the very short term. The other thing I would point out to them is that they are going to have a difficult time fielding teams if they're observing their current protocols. So most leagues, most teams are going to have to change how they deal with COVID in the face of Omicron. And we just don't know what that's going to look like. But it will probably be similar to what a bubble looked like before, until everyone is infected with Omicron. And then hopefully life will get back to normal again, like we saw over much of the summer.
Just looking at the rapid spread, what do you see when you look down the road towards the Beijing Olympics? Is there any way that these games can be held safely?
I cannot imagine that they will. I think Tokyo, in and of itself, had challenges, and that was not facing nearly the kind of challenges that we're seeing right now with Omicron. So I really can't imagine that delegations will want to send teams there. They may find themselves in out by using, I guess, political excuses or political reasons not to go. But from a infectious disease and public health perspective, it's going to be very difficult for that Olympic Games to go on.
All right, last question for you. For people who are so tired of COVID discussions over the last 20 months and really haven't been paying attention, if you had one opportunity to explain to people who've been just following this on the periphery why they need to pay attention and why this is so dire, what would you say?
It's a really loaded question, and I think I, like many others, am totally sick of this. I appreciate you having me on TV, but as you know, I'm pretty reluctant to appear on TV too often. And but the reason I am is because I think this really is a critical situation, and it's so critical because the threat isn't for most of the public who have been protected by vaccines. Even with 2 doses, they're going to be fairly well protected, but not nearly as protected as they will be with 3 doses. But the real threat here is with our healthcare systems and the people who are within them. And everyone at some point in time ends up needing the healthcare system. Sometimes people end up requiring it in ways that they'd never anticipated in a very short while. But this is all about trying to preserve that. And most of us, in fact, I'm going to say all of us, are really quite fed up with the virus and this pandemic. But it's not fed up with us. And this is, if anyone trains athletically and you're going through a tough workout, sometimes you just have to finish that workout. And, I guess that this is one of those situations where, we just need to keep on going. And I think the best thing we need to do right now is, to some degree, show some grit and say, there's a challenge ahead of us. Hopefully it won't be a very long-term challenge, that it'll be more of a short-term challenge, but we really don't know. But let's just deal with the challenge that's right ahead of us right now. And I think we'll get through all of it together.
Okay, Dr. Andrew Morris, thank you for joining us to talk about Omicron and the future of professional sports.
Thanks for having me.